My name is David Weiss. I'm an associate professor in the Department of Health Professions and Family Studies. So there are all sorts of benefits as a result of healthcare changes. These are hard to explain and hard to articulate. The president, I think, has done a wonderful job trying to articulate these things. But again, it's not so much what he and other supporters of healthcare change present, it's what individuals hearing them hear. And they may not want to hear, or they may not understand some of these concepts. Or politically, they may be against a president presenting an idea, or a Democrat presenting an idea, or a black president presenting an idea, or Michelle's husband presenting an idea. So for all different reasons, people have their objections to any types of changes that would be introduced. And I think, as I mentioned earlier in the presentation, that some of it is just the fear of change. They know what they have right now. They may not be happy with it. Who's happy with the present healthcare system? Two types of people. One, if you have health insurance, you're happy with the healthcare system. And number two, if you're healthy. Now, if you have health insurance and you're healthy, you're absolutely in bliss with the healthcare system. But get sick and start to see what happens. Lose your health insurance and start to see what happens. Talk to people who have had those types of experiences. Talk to those who have to live every day with chronic conditions. And interesting enough, the chronic conditions notion, as we age, we tend to have more chronic conditions, conditions that you live with, you just have to live with. The population is aging. We're going to see a rise in chronic conditions. How will we address those? How we'll address them is not so much by necessarily medications, there'll be some, but by abilities of individuals to take care of their own needs. You've got to keep moving to keep the joints lubricated. Keep moving, keep walking, keep exercising. No amount of illness. But interesting enough, the American healthcare system is essentially a curative system historically. It means you get sick, you come in, we dress it, we change the heart, we change the bandage, we give you an injection, we give you a pill, and then you go back and you do the same things that may have produced it in the first place. So we're very much curative oriented historically. We're going to have to make a dramatic change. Those who are happy with the system, they have the coverage, they have their health. Talk to those who have lost coverage, especially in this economic climate. We're hearing more about those people. Talk to those individuals who, fine, I don't have health insurance, but when I see my child suffering with an earache and we don't have the money to pay for it, or as a senior citizen saying, I don't have as much money to pay for my prescriptions, so what I've done, logically, I've cut the prescriptions in half. It doesn't make much sense medically, but this is what we're seeing. And we do see that. We've seen it anecdotally. Talk to individuals and you do that. One can say, but that doesn't seem right. Personally, that doesn't seem right. So me, for an ethical concern, that's a dramatic, dramatic concern on the healthcare situation. The concern for the uninsured, the concern for what happens when individuals get sick. And I have to say, that's all of us. We'll all at some time get sick and have to use the healthcare system. All of us at some point will most probably be victimized by serious illness, either for ourselves or a member of our family. Americans have some strange attitudes. One of the attitudes they have is that they look at death as an option. Death as an option. They say, gee, I'm going to beat my cancer, I'm going to beat this, I'm going to beat death. Well, as far as I know, death has a 100% mortality rate. I don't think anyone has ever beaten it. But yet Americans have this notion of trying to beat death. As a society, we haven't discussed those notions of what happens when, at the end of life, it's time to say, it's time for some passing on somewhere. Yet we'll try to keep individuals alive, when perhaps reason and perhaps other considerations might say, maybe we want to consider that life does have an ending. As a society, we haven't been very good in dealing with it that way, further complicating the whole discussion about healthcare and the health issue.